how important it is to not become your diagnosis, whatever that may be. So what was the one thing you did, after you were diagnosed? What was the one thing that saved your life? And so much of it is I never have seen myself as a cancer patient. Just like maybe you don't see yourself as a Lyme patient or whatnot. We were people who had experiences with those conditions, but they did not define us. And that's what I feel like I work so hard to change, continue to change within myself and those that I have the privilege of coming in contact with.
Thank you all for joining us for another awesome episode of Bioenergetics Beats. I'm Heather Gray, a functional diagnostic nutrition practitioner and certified bioenergetic practitioner, and today is brought to you by Nikki, Unleash the Wellness Within. It's a non-invasive, easily affordable, highly effective approach to wellness. It's a wearable device that puts frequency better based life in your hands and on your wrist. You're going to make sure to stay till the very, very end because as usual, we have a phenomenal giveaway, but you're not going to want to miss one word that my next guest is going to talk about because she's a personal friend of mine. I know she's just amazing. The stuff that comes out of her mouth is just, you're not going to want to miss one word out of this woman's mouth. Like, trust me. So let's welcome Dr. Nasha Winters to the show.
Thank you, thank you, thank you. Thank you for having me here with this amazing group of people. So I'm looking forward to it.
Absolutely. And I'm loving the topic. We were just talking before camera, like I had her on my show a couple of months ago, and we were talking about one of the quotes that she said about working with Lyme and working with cancer and how many private messages she's gotten since that's gone out because people, especially in the Lyme world, are feeling seen and validated. And Nikki, the Free Medica company, that was their kind of start, was into the Lyme world. And so I think that was just very validating for folks to hear. So God bless you, because I know to put your neck out there like that, right? Like that can backlash, that could backfire on you. So I just really appreciate your tenacity and your bravery of just continuing to show up and say what needs to be said, regardless.
Oh, thank you so much. Yep, I'm pretty accustomed to having lots of darts thrown at me. So whatever, but it doesn't deter my path forward as you mentioned. It's like you have some things are, you have to say some things that you don't want to say, and being the messenger is sometimes not a very comfortable place to be.
No, and it's funny. I always laugh that God has a wicked sense of humor because he gave me this big mouth but very thin skin.
Oh my God. I think I got that same data platform, if you will. So yeah, very much, very much.
Yeah, I'm like, ow, ow, ow. But
Yeah.
it's all good. So tell us a little bit about yourself, your background, how we kind of got started into talking about cancer in an alternative fashion, and just what makes you tick and why you do what you do.
Well, first, I love like even just the topic of this discussion or the topic of this podcast, bioenergetics beats so much speaks to where I've come from. From my own journey, I got into the cancer space because of my own journey with cancer. I'm now, the time of this recording, almost 33 and a half years out on a very aggressive, I know, bizarre, right? Anyway, I was 19 when I was diagnosed with terminal cancer. I'm 53 now, almost 54. And so it's just been this crazy, crazy journey. And so much of it has been about really digging into my biology, really digging into my biography, and really understanding the energetics of that make up my cells, to my tissues, to my organs, to this, meat suit that you have before you. And it's been that journey of exploring my own process, but then also having the incredible feedback of over 10,000 patients I had direct hand in their care, and now well over 100,000 patients in their indirect care by training other clinicians to apply what I've learned to these folks throughout my career. So it's just a really interesting, long-winded story, but really it's a story. It's one that continues.
Yeah, I mean, gosh, going back clear to 19, like that's crazy. Like and terminal, like, and you're still here, like that's even crazy. So I hope people are starting to hear some of these little nuggets that you've already been dropping, little seeds along the path, crumbs, because it's possible, right? Like you don't have to take those kind of diagnoses and give up.
Exactly, exactly. And
Right.
one thing I love that you brought, just even saying that diagnosis, I really appreciate one of my students. She's an amazing doctor herself, but she also went through my program. I heard her speaking on a podcast of how important it is to not become your diagnosis, whatever that may be. And I'm so happy because that's something that people say, what was the one thing you did, after you were diagnosed? What was the one thing that saved your life? And so much of it is I never have seen myself as a cancer patient, just like maybe you don't see yourself as a Lyme patient or whatnot. We were people who had experiences with those conditions, but they did not define us. And that's what I feel like I work so hard to change, continue to change within myself and those that I have the privilege of coming in contact with.
Oh, absolutely. I am constantly working with my clients' language. It's so common to call themselves limeys, like it's cute.
Yeah,
And
yeah,
I'm like, do not, no, 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 no. And then I had another client that I was working with, and she said, my breast cancer. She kept saying, my breast cancer. And I was like, whoa,
yeah.
no, you do not want to identify with that. If you're truly wanting to get better, your cells are listening.
They sure are. They're listening very much. And it's very much like it's just even a little a tiny switch of saying, my breast has some cancer, right? Like that's one different way of like, but what is it trying to tell me? What is that cancer trying to teach in me? What is it trying to bring awareness to from the, energetic level all the way down to the cellular biochemical level and everything in between? There are signals, there are messages coming out and into the body. And so those are the things we get to explore together. And the bioenergetics beat, I'm assuming you spend a lot of time in conversations like this, so it's not too far-fetched or too out there, even touching on what seems to be an esoteric topic, despite the fact it's very well elucidated that we are energetic beings.
Oh, 110%. Ugh, you gave me goosebumps. All right, on that note, that's a beautiful spot. We're gonna take a really quick break here. When we come back, we're gonna dive deeper into the nuts and bolts of all hands on deck. And what do you mean by that? And what is it gonna take to truly change the paradigm into, true, holistic health? So don't go anywhere. Stay tuned. We'll be right back.
Nikki plus Lyme is the next generation of Wave 1 technology, referred to in this testimonial.
The Wave device. Have you been able to get back to yoga?
I have, yes. Not even just teaching, but like my own practice. That was I remember so clearly. I went to a class last year and I wasn't even able to do like a basic pose because my body was in so much pain. And that's not something I've ever experienced before. I'm sorry, I'm getting like really emotional thinking about this. But it is really hard to have things that like you almost take for granted in your daily life and then suddenly to just completely lose the ability to have those things anymore. So it almost in a way is like there are silver linings to everything, and that is a silver lining, is just like being grateful for so many of the basic things that we often don't even give a second thought to. So short answer, yes.
Nikki Wellness Technology. Delivering frequency enhanced health. We are Nikki.com.
For someone thinking of purchasing a device, what advice would you give them?
Do it. Just do it. It's I really have explored so many between essential oils. I mean, much of what the speakers said tonight, there's been my journey through the years. This is by far the most painless. It's just really, for me, it was a synchronistic meeting, and I ended up being blessed with the device. So I feel that, universe is saying, we want you around for a while.
Nikki Wellness Technology. Delivering frequency enhanced health. We are Nikki.com.
Fantastic. Welcome back. Are you guys having as much fun as I am? Like, I might be having too much fun. No, that's no such thing. But yeah, let's dive deeper. Like, what do you mean by all hands on deck?
Well, it's funny because we started out the first part of the episode of talking about sort of being the messenger and getting attacked for that sometimes and saying things are difficult to say. And I'll give a really good example of how that's been very real for me this past week or two. The last 6 or so months, my team, my community, my network at the Metabolic Training Institute of Health and Terrain Holding Company, we have been in a lot of discussions around how we can be part of the solution in changing the metabolic mayhem of our population. Over 93% of us, in fact, are dealing with metabolic instability, metabolic brokenness, metabolic disease. And so knowing that there's only about 7% of us walking around doing just fine, the vast majority are not. And I was listening to some podcasts and some other pieces, especially around this new, presidential campaign that you can't kind of get away from, even if you try. And for me, what I was realizing is healthcare is not political, and yet it's been politicized, and you can't change anything around it without the help of the political nature, as much as I've tried to stay away from it. So what I have done the last few months is try to be one of the voices at the table of how can we perhaps change or upgrade the future of healthcare. And so in those discussions, I was getting some really interesting statistics, which showed that it will take 20,000 of us, being the FDNs of the world, the naturopathic doctors, the functional medicine clinicians. It will take a solid 20,000 of us just to make a dent in the United States alone. So my network alone, we have trained over 800 clinicians in the metabolic and integrative approach to cancer, but that's in 44 countries. So we are looking at about 50% of those here in North America. So let's just say, let's be really conservative and say, let's say we have 500 of us. My website alone, the mtih.org or drnasha.com, receives over 30,000 hits a month to our directory of people looking for someone trained in this methodology. So when I say all hands on deck, I sincerely mean all hands on deck. This is not a job for us. This is a calling, and this is absolutely what's necessary. So we actually have freaking people to vote in the future elections, because at the rate we're going, no one's going to be alive, however that plays out. So we've all had to step up as advocates and as activists, but we also need to get clinicians trained, whether you are coming from like an allied health professional in the nutrition world, a nurse, a physical therapist. Those folks can be trained into how to help this very struggling population. Or if you are a practitioner who has the ability to order labs or imaging and prescribe where needed, there's educational platforms for that as well. And so in our network alone, we launched 2 cohorts of each of those, a year. We have one starting in February 2025 for the clinicians, and one for the advocates, allied health professionals in April of 2025. We are constantly needing more people. Like the second we get a new cohort in, they're already filled a year out in advance of patients who are already lining up to get their care. We know what we do works. We're driven by data. We're not driven by dogma. We're not driven by anybody's, influence or belief systems. We're doing N of one, highly personalized, highly precision focused medicine. And we're making a difference, but there's just not enough of us. And so the all hands on deck and the hope for the future is that we all get curious and want to create a very different healthcare system together.
Absolutely. What she was kind of alluding to with not having enough people around to vote is there was a study recently done, I don't know, I want to say about 5-6 years ago, that was showing that for the first time in history, that the life expectancy is not gone up. It's going backwards, so that the children being born today are not expected to, live as long as their parents and age-wise. So it's going backwards. Like if that doesn't turn on some alarm bells for you, I don't know what will. Like that's not woo woo, that's not, doomsdaying. Like that was a study that's coming out saying, hey, there's something really going on right here. So thank you for bringing that in.
And it's interesting, there's a concept, well, it's not even a concept. There was a famous clinician known as Dr. Pottinger. People here have probably heard of the concept of Pottinger's cats.
Yeah.
There's actually a really excellent book called Pottinger's Prophecy. It's probably 12 or 15 years old right now, but it's still really relevant to understand that there was this guy, time before there were ethics boards and ethics committees. He took a bunch of wild cats, barn cats, and he basically put them on our diet. Right? Brought them in the house, gave them our cooked food. Within 4 generations, these cats became nearly extinct. And what he then did was he put them back to their natural food, into their natural environments. And within 4 generations, they started to recover completely. Where we are as a culture is we are in our 4th generation. We are in our own Pottinger's cat's process. This isn't doom and gloom. This is the reality. No one's doing it for you. That's why the patients are demanding something different. The clinicians are demanding to learn something different, and we all need to go at this together. And so we can turn that around. It may not happen for my generation, maybe not even your generation, but I certainly hope it'll make a dent for the generations to come. So there is something to fight for in the future. So as you know, as you talked about, like just the data every year for the past 5 years, as you noted, the United States is the only country that is losing longevity. And the scientists call it the era of despair. And so that ties into that, the mental, emotional, the bioenergetics of it all as well. It's the opioid crisis, so dying of overdose and dying of suicide. We are isolated. We are depressed. We are mentally broken. And so we are far more powerful when we align and ally ourselves to those on a similar mission and vision. And I have every bit of belief and every bit of hope that we, the people, can turn this around. And the Margaret Mead quote of never underestimate the power of a small group of intentioned people, that's us. And that's the community that I represent and the community that keeps growing, and people just like you, Heather, who are also very much part of that mission and vision.
Can I get an amen? Like, oh my gosh, you brought me to goosebumps. You're bringing me to tears. Like, well, it's just because you're speaking the truth. You're speaking from the heart, and I can feel your passion, because it is there. All of us, there's too many people suffering needlessly, at the hands of ignorance for the most part. Like, I don't know about you, but I was brought up with, this is a part of a balanced breakfast. Bullshit. That's diabetes in the making, So that's
Yeah.
kind of where it starts, right? Like, and it's still like working with Dr. Jen's patients. She was on actually a few episodes ago. I'm still shocked at the amount of doctors who will tell their patients who are going through chemo that it doesn't matter what they eat.
It's devastating to me. I mean, 30 plus years working in this field, like literally looking at the same, research that they're apparently not looking at. It just blows my ever loving mind that we are promoting such ignorance, because that tells you right there that this is industry driven and not healthcare driven.
Oh, can I get another amen? Like, can you see why I love this woman? Like the wisdom nuggets, the truth bombs that just keep falling out of her mouth. Like, are you keeping track? What are we up to, like 50 now?
Oh, that's so fun.
So we've got about 10 minutes left. Can you give us just some practical, either one or two little nuggets of things that people can start implementing in their life today to make a difference?
Absolutely. I think a lot of people think that in order to somehow stay alive and stay healthy, you have to be able to invest, thousands and thousands of dollars into expensive biohacking tools. Now, there are people who do, and there are people who, fund entire industries on that, which is great because we learn from those. There's data that's gathered from that. But we've got to get back to the fundamentals, you guys, and you'd be shocked at how far we are from that. When I'm working with clients who've gone and dumped 150K at an alternative cancer clinic somewhere in North America or abroad, I will sit there and say, so tell me about your daily habits, tell me about your diet, your lifestyle, your exercise routine, your exposure to light, your exposure to dark. Tell me about those. And they look at me like I've got 10 eyes. And
Are you pooping daily?
Right. Like the fundamentals. So we call those like the determinants of health. So literally the simplest thing is, do you know when and what time your sun rises and sets wherever you live? Once you learn that, you want to make sure you are outdoors or in a window facing the direction, even if it's cloudy, even if it's raining, even if it's snowy. That is a very ancient primal way to reset your entire circadian rhythm and to allow the chemicals that are part of the daytime and part of the nighttime to be stimulated and released. Really simple. So I try and go every single day without ever missing a sunrise. And most of the time I will also get a sunset. I have to go out of my way to look for the sunset though, but it's easy for me to see the sunrise from where I am in the morning. So that's just like kind of my non-negotiable. The other thing is fasting. Such a place that we all were natural fasters since the beginning of time until about the 1960s. Some doctor, probably some industry said, oh, breakfast is the most important meal of the day. Oh yeah. Okay. Thanks, Kellogg's. And but that's where simply even studies showing that 13 hours. So there was a really huge breast cancer study about women who fasted 13 hours a day, So meaning finish dinner at say 6 p.m. and don't eat anything but drink water by until 7 a.m. the next morning. They weren't even looking at what they were eating. It was when they were eating, and realize that people fasting 13 or more hours, 13 to 16 hours a day, can completely reboot and manage their immune system, their immune cells, taking out the garbage and making room for other biochemical processes to work well. Again, free. People's work like Dr. Sachin Panda and all the circadian rhythm biology, instead of getting caught up in the dietary dogma wars, maybe start with the timing of your eating. Eat within the light of the day. Maybe squish your eating window to a smaller and smaller window and see how that feels. And then if you are dealing with some chronic illness, there are a multitude of ways, like people with extreme GI issues and extreme autoimmune stuff can really do well on a few weeks to a few months on a carnivore diet. People who have really extreme autoimmune flare, even a 3 to 5 day water fast can turn that around. And those who are trying to metabolically reset their cardiovascular disease, their diabetes, their obesity, their cancer, a therapeutic ketogenic diet can be very, very helpful. But ultimately, the common denominator is eat real food, seasonal food, local food, as close to source as possible. Nothing added, nothing factory created, and you'll do yourself a pretty darn good, lot of good with that alone. And it's so funny, we've gotten so far from even the basics that now people who question what they're eating get a diagnosis of orthorexia.
Yeah.
Right. And so the fact that I am concerned of what's going into my food it now places me in the loony bin category or a conspiracy theorist. And yet it's super easy to do a little, PubMed dive into the research of showing the differences of highly processed foods, of high carbohydrate intake, of insulin problems, of seed oil, inflammatory processes, you name it, it's out there. But the industry doesn't want you to see that. So you have to be a little bit of a detective yourself to go and look deeper. So really the CDC is what I talk about, my own version of the CDC. So circadian rhythm we've touched on, diet we've touched on, and the big one, here it is, we just spent time talking about the isolation, the era of despair, is community, is connection. And this is why conversations like this and podcasts like this can be a lifeline for many, many people. But go out of your room, of your Zoom room, go outdoors, volunteer, get to know people in your community, find a community garden. This is what the blue zones profit from, not from what they're eating, it's who they're sharing their meals with. And so that's a really powerful piece here of just maybe my words of advice is to follow this version of the CDC over some of the other.
I was wondering where you were going with that. I was like starting to cringe there for a little bit. I'm like, Dr. Nasha, what are you saying?
Exactly. But it's all those things I described free.
Yeah, 110%. Another one to go look into would be Weston A. Price, who was a dentist, who followed a lot of different cultures. Same thing, watched them eat the Western American diet, saw within 1 or 2 generations what it did to their mouth, what it did to their health, and then got them back on their traditional diets and how it was able to turn around. Like, you don't have to dig deep. Like you just have to barely scratch the surface and all the information's there. It's quite amazing.
Well, I love that. And I love that you brought up, because Pottinger Price Foundation used to be together. They're separate entities now, but
I
both
didn't
of
know
these,
that.
right. And both have been promoting what you and I are talking about. So they have their own conferences, they have their own newsletters. Both these authors or both these doctors had their own writings and books and journal entries for years. Go digging. There's this wisdom. They were sounding the alarm in the industrial food revolution in the mid 1800s saying, we are really screwing things up. They'd be flipping in their graves right now to see what we've done to ourselves, especially post World War II. We're effed, right? Unless we completely come back and change it ourselves, which we're doing. People like me, people like you, people like my regenerative farming community, we're all coming back full circle to change, to reverse engineer that Pottinger's prophecy.
Oh my God. Amen. Thank you again so much for just playing full out like you always do. So here's the shameless plug time of the show. Like, what courses and what are the courses about and where can they find out more?
Perfect. So right now, go check out Metabolic Regen. That's like our university. And this is our clinician, our patient advocate, our sort of in between. So folks who have like a lot of medical background, but they can't perhaps prescribe, have a course option. And we have for the layperson option, educate. it's hard to kill educated people, right? And so it's like, educate yourself, whether you're a clinician or a layperson or anything in between. Please come and find us, mtih.org or metabolicregen.com or drnasha.com. Any of those places will get you information. And another place to learn free information is on my podcast, metabolicmatters.com. The list is long of every topic. So I love that, Heather and I've been on hers. She'll likely end up on mine. We are constantly cross-pollinating, learning from each other and sharing this wisdom. And then the book that kind of started it all and got me on stages, despite the fact that I've been living it for over 25 years, when that book came out, is The Metabolic Approach to Cancer. There's a great online questionnaire that you can evaluate your own terrain, the things that you're personally exposed to, so you can start to get a sense of maybe where you should prioritize your self-care, and further testing and evaluation and working with people like Heather to make sure you are doing the right things to prevent disease and create resilience and health.
Absolutely. Also, make sure to go visit wearenikki.com/podcast. Enter in BioBeats to get 10% off your Nikki device. And because we really love our customers so much, and a way we show our appreciation is we give away a Nikki device plus the wellness set of frequencies. It's a $598 value on every single show. So make sure to go to the show notes to find out how you can enter. Good luck to you, and make sure to have a healthy day. Thanks for joining us.
The very first day that I wore the device, I slept through the night, which is amazing.
It looks like a little watch, but it's actually a frequency device. It's bioenergetic, so it has this little frequency light situation that goes into your arm, and it pretty much makes an immediate difference.
So there's like a sleep mode. When I go mountain biking, I throw it on an energy booster. Once I'm done mountain biking, I actually switch it to the other mode they have, is pain and relief.
When I'm in a stressful situation and I put it on, it helps me almost immediately. I immediately feel calmer, whether that's a frequency or me knowing that it's working or knowing that it's helping in addition to that.
One of my buddies was like, do not discount this. This is an amazing device. You've got to give it a chance.
It's got so many options. I'm just going to go over, it's like a menu that you can choose. It's so easy to use. You just click on what you like. For example, it's got travel, pain relief, energy boost, allergies.
I really, really love this device. In fact, I have two of them because when one is charging, I want to wear the other because I'm never without it.
It will never give you something when your body doesn't need, and it is not natural. That's what I love about the device.
Put it on focus, maybe halfway through the day as I was losing focus. And within about 10 minutes of turning on, I feel like my brain is just like, I'm connected. Like, wow.
Trying all the frequencies, and I love it. The one I'm using right now out on my walk is energy. It just energizes me. And I'm finding that I've got more stamina and more energy than I thought I would.
My Nikki helps me sleep better at night and helps me feel less stressed.
I really been enjoying it. So I've noticed my energy's been up. I've been sleeping better.
So the Nikki is one price, and then you pay for the frequency sets separately. So you can get the wellness one, which is awesome. I really do love the new Lyme frequencies so much. It's incredible.
Nikki Wellness Technology. Delivering frequency enhanced health. wearenikki.com. The views, information, and opinions expressed in this content are solely those of the individuals involved and do not necessarily represent those of FreeMedica. FreeMedica Technologies, Inc. and its employees are not responsible, nor verifies accuracy any of the information contained in the following content. The primary purpose of this content is to educate and inform. This content does not constitute medical or other professional advice or services.